www.healthcmi.com. Acupuncture Continuing Education Online. Today, Acupuncture Beats Drugs for Cognitive Impairment. This was published in the HealthCMI News Department, September 26, 2019. Simply go to healthcmi.com, click on News, and take a look at the article. This is a great article, not just for the layperson or a person interested in their health, but also for licensed acupuncturists to see the exact acupuncture points used and what type of results were accomplished. Here, researchers find acupuncture more effective than selective acetylcholinesterase inhibitors, the drug used often for the treatment of vascular cognitive impairment. So the researchers from the first affiliated hospital of Tianjin University of Traditional Chinese Medicine determined that a particular type of acupuncture was effective, and this is the Xingnao Kai Chao technique, or the walking the brain and opening the orifices technique, which is outlined in this article. Pretty high success rate measured at 4 and 8 weeks. Total treatment effective rates came in at 74.51% at 4 weeks and 91.11% at 8 weeks, compared to the drug group, which came in at 4 weeks at 54.05% and then did respectable at 72.72% at 8 weeks. The acupuncture outperformed the drugs by about 20%. Keep in mind, this drug is used for people with Alzheimer's disease, general vascular cognitive impairment, many things. What we know now is that acupuncture can slow the degradation of memory loss, help with recall, help with cognitive processes. And they're exactly measuring not just symptomatic measurements and evaluations, and those instruments, such as the Montreal Cognitive Assessment, which was used here, but also serum levels associated with cognitive impairment were also regulated by acupuncture very successfully. So again, not just things like the Ability of Daily Living Scale and the Montreal Cognitive Assessment Scale, but also things like serum levels of insulin growth factor 1, vicinin-like protein 1, and so that's IGF-1 and VILIP-1. And those, again, are prognostic biomarkers of cognitive impairment and dementia. Also, mRNA expression of these factors was also measured with real-time polymerase chain reaction. So they get into not just the subjectives, but the objectives here to try to show some of the effects in the bloodstream from acupuncture treatment. It was a relatively robust schedule, a whole lot of acupuncture packed into that 8-week period, and it achieved results. Again, this is not going to be something where someone goes in one time a week and then that kind of idea. No, this is a concentrated protocol of acupuncture. If I take a closer look, we find that needles were retained for about 20 minutes. Treatment was given 2 times per day. How do you like that one? At 9 a.m. and then at 3 p.m. 6 days per week for a total of 8 weeks. So that's the level of care that's needed to get this type of result. This is a very serious condition. It can degrade over time. So it's not just about getting back something you've lost or sharpening up, but also preventing further deterioration. So again, this is 8 weeks of concentrated care. Keep in mind now that everything was measured from effective to significantly effective to recovered. So the total treatment effective rate shows everything from modest improvements to excellent improvements. So I'm not saying that this is a cure for something like vascular cognitive impairment, but it can be tremendously helpful in the overwhelming majority of patients. Again, access to care issues are going to be there. Now think about it. Someone has cognitive impairment. Are they going to be the ones scheduling appointments and operating motor vehicles, things like this, to get to their appointment? This is a problem. So sometimes there's family involvement or caretakers involved, depending on the level. At early stages, obviously, people can handle this themselves. And then there's financial. Think about how much care. We talked about the concentrated round of acupuncture required to get this accomplished. So this isn't, again, something that can be done very casually. It has to be done in a concentrated fashion 2 times a week for an 8-week period. What's nice, though, is once these results are accomplished, a lot of other research, which you can go to Health CMI and take a look at it, shows that with simple monthly follow-ups, we can often maintain the results for quite a long time. But I would say that for something as serious as this, less than monthly follow-ups for serious issues with vascular cognitive impairment may not be adequate. So again, it's going to be that follow-up care after the concentrated round that keeps that long-term improvement. So take a look at this article. Again, go to healthcmi.com, click on news, and look at this article entitled Acupuncture Beats Drugs for Cognitive Impairment. For acupuncturists, what's interesting here is the choice of points. So Schwigo GV26 was used. Yes, not the most comfortable point on the Filtrum. But the others are very standard and comfortable. By contrast, PC6 Neguan, Sanyin Jiao, spleen 6, Sishensang, of course, the classic EXHN1 on the scalp, and Chuanzhong, GB39, and Kidney 3 Tai Shi. So I would say that this treatment would be very comfortable overall. However, it is rather robust. So once the needles are in, once they're being retained, I think the patients will have a very, very peaceful experience or dream or relax, but getting that Schwigo in there and keeping it on a comfortable level will be a slight challenge, but not overwhelming and certainly worth the results. We've seen other treatment modalities with less aggressive needling techniques than the one used here because they use the Zheng Cui Zhuo technique, the heavy sparrow pecking technique on Schwigo. So that's very strong. So absent that, it's a very comfortable treatment. But they are recommending the heavy sparrow pecking technique, which again is somewhat aggressive. The others, very straightforward techniques. So nothing unusual there. I would like to see research done without the Schwigo sparrow pecking technique. That would be interesting because we have seen other research suggesting that may not be necessary. Nonetheless, this is this protocol by the First Affiliated Hospital of Tianjin. So that's the, again, the Xing Nao Kai Chao technique, the walking the brain and opening the orifices approach. So a little bit aggressive and yet getting the results. Can't argue with results. Take a look. Go to healthcmi.com. I hope you enjoyed the article and thank you for listening. www.healthcmi.com